Now we're going to talk about kind of pressure and changes throughout your blood vessels. So first, kind of looking at how much blood flow is going through your vasculature, we're going to go back to the heart and talk about cardiac output. Not as extensively as we did with the heart, but if you remember, cardiac output is heart rate times stroke volume. So then stroke volume is your end diastolic volume minus your end systolic volume. So how much you had in your heart and how much you pushed out or is left. So that's how much per minute the ventricle is being able to push out, and then heart rate. So you must generate enough pressure, so enough output of kind of mils per minute. So remember, cardiac output is mils per min. So you need to produce as much pressure as you can to actually push the blood through a large amount of capillaries. You have capillaries everywhere, and they're teeny tiny vessels. So we need a way to regulate both the systemic and pulmonary circuits between the left ventricle here and the right ventricle here. So we have auto regulation, which is going to act locally. So these are things that the capillary beds are able to auto regulate whether blood's going through them or not. So that is part of auto regulation. We also have central regulation, which is the nervous system, mainly is going to be brain and spinal cord, but mainly the brain. And then endocrine. So we're going to talk exclusively about the endocrine system later on. And so the different ways that it can kind of regulate the cardiovascular system with hormones. So what do the brains and the hormone do? They'll adjust your heart rate. So we know parasympathetic is going to decrease your heart rate. Sympathetic is going to increase your heart rate. Stroke volume. So we can increase the mils per beat that are going out of the heart. So how much? Peripheral resistance is going to be our major one. So heart rate and peripheral resistance are going to be the major one. Peripheral resistance, we'll talk about all the components of it. But this, a lot of times when we talk about resistance, can increase or decrease the blood pressure. So if you're increasing peripheral resistance, then you're increasing your blood pressure. If you're decreasing your peripheral resistance, you're decreasing your blood pressure. So that's a way we can kind of regulate flow, because then we'll talk about increased pressure can increase, change the flow, and we'll talk about kind of extensively that coming up later. You can also regulate, at least in some ways, the venous pressure that is dependent on the valves and skeletal muscle. But all of these you can kind of adjust to make sure that your cardiac output is enough that it's getting blood to go everywhere that it needs to go. So talked about blood pressure. So each time your heart beats, then it's going to change your blood pressure a little bit. So blood pressure is everywhere, all the blood vessels, but significantly we worry about arterial pressure because it's much higher than venous pressure. Why is it higher? Is you're going to have to push blood through smaller and smaller vessels. So you think about our arteries are going from large to small. So they're going from the aorta to medium arteries to then arterioles and then to capillaries. And we'll talk about kind of how that increases peripheral resistance coming up later. And then vessels or veins are going from small to large. So it actually gets to the point where you can increase the opening and it decreases pressure. Again, we'll talk about how that relates later. So flow through the blood vessels is influenced a lot by resistance. So that peripheral resistance or total peripheral resistance. So peripheral resistance, remember, if you're resisting something, you're pushing against it, you're stopping it, you're slowing it down. So resistance as a whole is looking more again at the arterial side. And so you can actually see that it's opposing movement. So if you have increased peripheral resistance, you'll have a decreased blood flow. There's more kind of stopping it and slowing it down. If you have decreased peripheral resistance, then you're going to have increased flow, because you're just going to have less kind of stopping it, so less slowing it down. So you think of it as if you have an area in a neighborhood where you have a bunch of speed bumps, so you're going over and you're having, not that there's bumps in here, but just think of it that way. So this is going to slow you a lot down because of the resistance of the speed bumps, versus if you just have a straight road, nothing's impeding it, well, you can go a lot faster. So just think of it that way. Peripheral resistance is something in the way slowing you down. Why is blood flow important? Kind of looking at it, and why are we slowing it down? So as you're going from smaller and smaller artery, your blood flow is slowing down more and more. Why is this important? Why do we want capillary pressure low and we want blood flow slow? So low and slow is capillaries. Why? Think about what the function of the capillaries are. Well, you want exchange. So you want exchange of nutrients and carbon dioxide and oxygen to go back and forth. Well, that takes time. So the more the kind of time that you have, the more diffusion and exchange can occur. If you're going and speeding through something, well, there's less time for exchange. Also, we're going to discuss about how this happens in another video of how exchange actually occurs. But if you're changing the pressures within the capillaries, you're going to change kind of exchange rate. Where if pressure's higher, you actually might get more leaving, but not as enough coming back in, which is important because we want to get rid of oxygen to bring to the tissues, but we still want to take up carbon dioxide. That's part of it as well. So if you're changing pressures, you're actually changing this kind of relationship that we have. Again, we'll talk about that more at a different time. So blood pressure in the veins isn't as kind of worry about, you think about it's kind of far from the heart, so it's not as dependent on heartbeats. It's more dependent on those internal valves that we talked about previously, where there's valves that maintain one-way flow. So you can't go backwards on the valve, you can only go this way. So that's helping to maintain pressure. Also your skeletal muscles. So squishing your veins with your muscles at some point is going to increase the pressure and help with blood flow as well. As blood is moving towards the heart, so remember veins are going from smaller to bigger. So we're going to talk about resistance a lot coming up. So resistance is going to get decreased because you're going to have wider diameter. And like I said, I'll explain coming up. So as you're going, there is going to be an increased chance of blood flow because you have less resistance. Again, remember the speed bumps. If you have less speed bumps or no speed bumps, then you're able to go a lot faster than if you have a lot of speed bumps, then you have to slow down. Remember, venous return from the cardiac system, or looking at the heart, is the amount of blood that arrives at the right atrium. So from the veins, from mainly the superior and inferior vena cava each minute. But on average, it should equal cardiac output. So the amount that's pushed out should be the amount that's coming back. Excuse me. So this is just a summary of kind of all the ways we can regulate. So first talked about cardiac output. So the heart has to generate enough pressure to go through all of the peripheral capillaries. So the heart has to contract enough to get your circulation to every part of your body. Then arterial blood pressure is going to be one of them as well. So this again is pressure between the whole cardiovascular system, but we look at arterial pressure is a lot higher than venous pressure because again, it's going from large to small. So it's harder to go from large to small than going small to large. Then peripheral resistance, like I said, peripheral resistance is going to be opposing movement. So it's going to be slowing things down. That's our speed bumps, in my analogy of kind of driving. So peripheral resistance, we look at the arterial system majorly because there's going to be a lot less resistance in the venous side. Again, capillaries are low and slow, so their blood flow is low and their pressure is low. Again, that's important because of diffusion. What's occurring is transfer of nutrients back and forth between the capillary and the interstitial fluid. So capillary exchange needs the low pressure to maintain kind of the exchange and how it happens. And then slowing down allows for more time. So you'll be able to do more slowing down than if you're just speeding through. Again, venous pressure depend on the valves and muscular skeletal muscle compression is going to help with venous pressure. It's so far away from the heart. Again, it's gone through the large arteries to the medium to arterioles to capillaries. So you've gone a long distance. So the heart can only kind of pump so hard. So you have to depend on other mechanisms. The valves and skeletal muscle compression helps with pressure and getting venous blood flow back towards the heart. And then you're decreasing resistance as you go. So it's going to also be important with those valves and muscular compression to help maintain the pressure. Again, venous return is going to be the amount of blood arriving right. That's actually a typo. It should be the right atrium. On average, it's equal again to how much is coming out. So this is just looking at kind of the cardiac cycle. Again, you have regulation versus neural. Mainly, it's going to be sympathetic, parasympathetic nervous system, brain as well. And then hormones are going to regulate. Again, we'll talk about hormones later on. So they're going to adjust heart rate. Majorly, the hormones can do that, like thyroxine, and your parasympathetic and sympathetic. Stroke volumes, the amount of blood that's actually leaving the heart per beat. And then looking at peripheral resistance is going to be a major one that um, we can look at. So again, we'll look at that next. That's going to significantly affect flow going through your arteries. And then looking at venous pressures. So again, total peripheral resistance. So looking at peripheral resistance, again, we're going to look at mainly going to be in the arterial side because it's more significant there. Heart has to create enough force to overcome this total peripheral resistance. So basically, it's going to be your left ventricle. It has to squish enough and produce enough force that's going to get through all of the circulation to get back the heart. So yes, again, majorly it's going to include the veins, but more resistance is going to occur in the arteries than in the veins. So that's why we're kind of talking about it more. There's three factors that total peripheral resistance adds up to. So there's three factors that actually kind of either increase or decrease peripheral resistance. Vascular resistance, so resistance that's actually happening in the blood, viscosity, and turbulence. So vascular resistance is the first thing we're going to talk about. So friction and vessel length are related. Blood is going to bump against the walls of the blood vessels and it's going to cause friction. The longer the blood vessel, the more time you have for that friction and have that contact, you're going to have greater vascular resistance. So, what happens is, again, you have a blood vessel. Blood cells are flowing, so they may bounce and then come back in, and then they might bounce on the other side. So it's not like they're going a straight line. Every time they're hitting the wall, they're slowing down. Again, remember, resistance is the opposition of flow. So you're actually bumping into the wall and you're slowing yourself down. So again, think about it as if you hit kind of walking and all of a sudden you hit a wall, well, all of a sudden you slow down and then you hit the other side of the wall, you're slowing down. So it slows down the movement. So this is just saying literally if you have a short blood vessel, well, you're not going to hit the wall as often. There's less chance, there's less space to actually hit the wall. If you have a really long blood vessel, well, there's more opportunity to hit the wall. You could hit it here, you could hit it down here, 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 all the way along. So there's just more times to hit the wall to slow yourself down. And again, resistance is opposing flow, so it's just going to slow down the flow. So this is what it's saying. Resistance to flow with this short blood vessel, say it's 1. Well, you double the size of the blood vessel, so the area is 2, then you're going to actually half the flow, meaning this blood vessel, if it's flowing at, I don't know, 1 mile per hour, again, it's not going that fast, but just showing you, then this would be going through a 1/2 a mile per hour. So double the actual length of the blood vessel and you half the flow rate. So you're doubling the resistance to flow or to resistance, and then you're halving the flow. More significantly, so again, blood vessels, we do know that the longer vessels are going to have greater resistance, but this can't vary. Your blood vessels, at least as an adult, are the same length they're going to be. You're not growing, you're not changing, you're not increasing the length of your vessels. So, more significantly, part of vascular resistance is the diameter, which we change this constantly. So, friction and vessel diameter are related as well, but they're even more significant related. So, we only have, if you double the length of the blood vessel, then you're going to half the flow. This is going to even have a more significant of diameter has actually more significant change. So friction is looking at also kind of the layers of blood flow. So the ones closer to the wall are moving slower than the ones that are in the middle because they're not hitting the wall. If they're in the middle, they're hitting the wall and it's slowing them down if they're outside. So if all of a sudden you have a large blood vessel where a majority of it's in the inner parts and can go fast, then you're not going to have as much resistance. If all of a sudden you go and you decrease your size or your diameter of your blood vessel, well, more of the blood is actually going to be hitting the wall and slowing down. There's less room in the middle where you can just kind of speed along. So the middle layer is going to have less friction and able to move faster than the outer layer. So the greater the diameter, more blood can move fast. So you have a decrease in resistance. So they're inversely related. If you increase the diameter, then you decrease the resistance to blood flow. So you're decreasing the resistance, blood flow can move faster. Think of it's less opposition, less speed bumps. Again, you're increasing the diameter, you have less speed bumps, so you're able to move faster because there's less resistance, there's less speed bumps. If you decrease the diameter, then you're going to increase the resistance because more blood's going to be hitting the blood vessel wall. It's going to slow it down. So you're going to have a decrease in flow. So if you go from 2 speed bumps to 4 speed bumps, well, you're going to go slower here than you can go with 2. So you're increasing the resistance or the opposition to flow. And so you're decreasing blood flow. Why do I have straws and the milkshake on the slide? So think of it this way. You get a really thick milkshake. You order it, smoothie, whatever you want. Something that's kind of thicker, but it's a drink. All of a sudden, someone gives you a coffee straw or a tiny, tiny straw right here. So this more significantly, if you can imagine if you're putting that straw in this milkshake and you're trying to drink it from this straw, you are having to really use a lot of force to try to get the milkshake through this straw. So it's the same thing. There's so much resistance to flow in this straw for your milkshake that you have to use a whole lot more pressure and force to get through this straw versus all of a sudden they give you this straw to get your milkshake out. All of a sudden you're sitting pretty and you're just sucking down your milkshake because there's less resistance to flow. It'll just go right through and you'll be able to drink it a lot easier. So think of it that way. The smaller the straw, the more resistance and the slower you're going to get your milkshake as well. So you may be working on this for 5 minutes before you even get some of your milkshake versus this will just be 5 seconds and you'll be drinking your milkshake. So think of it that way. So diameter again is the most important part of vascular resistance, and this is something we change all the time. We can change, and that term of vasoconstriction, where we're making the diameter of the blood vessel smaller with that smooth muscles contracting, especially in the arteries, versus vasodilation, where we're making that diameter larger. So we're constantly changing this in our body, of changing the amount of vascular resistance we have. And this again changes your blood pressure as well. If you're vasoconstricting, there's increased resistance, increased pressure, decreased flow. Vasodilation, you have decreased resistance, decreased pressure, increase the flow rate, meaning blood can flow easier. So if 2 vessels have the same diameter, but one is twice as long, you have 2 times the resistance to flow. Again, if you have this blood vessel versus this one, even if they have the same diameter, then this one is going to be 2 times more resistance to flow moving. But again, that's not changing. You can't change the length of your blood vessels. So what we look at, and a more important factor, is diameter. If 2 vessels are the same length, but one is twice as wide as an other one, then the resistance is 16 times. So you go from a 2 times to a 16 times. Same length, but that one's that small, and then you have one that's this large. So this one is going to be 16 times more resistance to flow than this one. So again, you're going to have a smaller diameter. So you have 16 times more of the resistance. You have increased pressure. And since you are resisting flow so significantly, you have a significant amount of slowing of the blood. Opposite is true. Larger diameter, then you have decreased resistance, decreased pressure, increased blood flow. You can flow a lot faster through this than you can here. You're bouncing on the sides all the time and you can't move much. Better picture. So this again is looking, the diameter in this blood vessel is 2 centimeters versus 1 centimeters. So the flow resistance here is 1. So there you can see these. So all these outer thinner layers or thinner arrows are moving slower versus the inner kind of middle layer. You decrease the diameter by half, so 2 to 1, you get 16 times the resistance to flow. There's a lot more. There's no really large arrow here that can have blood flow go really quickly. It's all kind of slowed down because you have an increased resistance, more speed bumps when you decrease the diameter. So another factor of peripheral resistance is going to be viscosity. So the major one that we can control and change again is the diameter of the blood vessels. Viscosity we don't usually change, but it can change. So we look at it in viscosity is a resistance because of molecules interacting. So resistance with vascular is interacting with the wall. Now we're looking at how many molecules are bouncing into each other. So again, suspended materials is how much they're going to be in kind of dissolved in the liquid. Blood going to be all these suspended cells and materials in the liquid. So lower viscosity fluids where they don't have as much interaction and movement between the molecules actually have lower resistance. Higher viscosity fluids are going to have more interaction among the molecules bouncing into each other more often, so it's going to slow down movement and have higher resistance. Again, resistance is stopping flow. If you increase resistance, you're decreasing flow. So think of it as this. So water has a low viscosity. So if you pour out water, it goes out pretty fast. If you're dumping water into a cup, then water comes out really quickly. Versus molasses or syrup or something like that, that takes forever to get poured out. It takes a lot longer than water. So viscosity of molasses is a lot higher. The resistance to flow is a lot higher, so it goes a lot slower. Water resistance to flow is a lot lower. It's lower viscosity. So you have a lot faster flow. Why do we worry about this? You can change the viscosity of your blood, at least in some sense. If you are dehydrated for whatever reason, you have less water in your plasma in your blood. Well, this is actually going to increase the viscosity of your fluids. Also, if you have more cells, if you have more molecules that are jumping around and interacting, then you're going to have an increase in viscosity, higher resistance, less flow. So if you're dehydrated, you can actually worry about decreased blood flow because of the higher viscosity. So blood viscosity again is about 5 times that of water. So it is thicker because it has a lot more stuff in it, suspended in it. And so it's because of the cells and the plasma proteins. Viscosity again isn't normally changing. It's normally pretty consistent. But if you have anything that's affecting hematocrit, remember that is the number of red blood cells or erythrocytes, or looking at plasma composition, so increased plasma proteins. Again, a major factor is decreasing water, so dehydration. So that can change the viscosity of your blood and affect your peripheral resistance. So just looking again, viscosity, so looking at water, blood is a little bit more, again, 5 times. So if viscosity of water is 1, blood is 5. Obviously, molasses is pretty high. Last thing that affects total peripheral resistance is another one that we really don't kind of change as much. They can change because of the vessel diameter, so it can be secondary to changes in your vessel diameter. But most often, that kind of changes and then kind of evens out, I guess. So turbulence, think of it as when you're flying, if you've flown before, and all of a sudden you hit turbulent air and you have a bumpy ride. So air or some sort of liquid doesn't honestly always go in a straight line. If it hits a wall or something happens, then it's going to swirl up here and then it'll swirl down here and kind of moves around. So the more swirling, the more resistance to flow or slower flow that you're going to have. If you're going around and you just do one twirl, well, it's still going to get pretty quickly. If you are just twirling your way down the road, just twirling and twirling, twirling, well, it's going to take you a lot longer to get the same. So again, this is going to be slower flow or increased resistance than this one, which is going to be higher. Sometimes we have natural turbulence because of high flow rates, so you're actually going to see a lot of turbulence in the aorta, and it might slow down a little bit and have increased resistance. Irregular surfaces, so we talk about plaques on the blood vessels. So if all of a sudden you have plaque with lipid on it, well, that's going to slow down flow because it is literally like a speed bump. All of a sudden you're coming around and oh, you have to go around. So major one is again sudden changes in vessel diameter. If all of a sudden your blood vessels are dilated and you vasoconstrict, then that's going to cause turbulent blood flow because all of a sudden the cells that are over here are going to be just pushed in and without kind of any time or warning. So they just get pushed in the middle. Turbulence again, remember talked slightly about in the heart. And so turbulence for the third and fourth heart sounds. Because of blood flow, you can actually hear some heart sounds, and it's because of normal flow throughout the heart because we're contracting and changing the diameter of the chambers, and so there is some turbulence in the heart. Again, increased turbulence, increased resistance, slow down the blood. So this is just a picture again. This is looking at a plaque. So having kind of arteriosclerosis, you have blood flow going normally, and then all of a sudden you hit a speed bump and you're swirling and flowing. Well, that's slowing down flow because it's increased resistance. You have to go around. So it's going a lot faster here, then gets all discombobulated, and then it slows down over here. So another thing is the volume of blood that's going through each vessel can have kind of effect. Again, it's inversely, so blood flow is inversely related to resistance. Increased resistance, decreased blood flow. You heard me say that a bunch of times. Decreased blood flow. If you decrease resistance, then you're going to increase blood flow. So you're going to increase your speed. Oftentimes we look at pressure gradients. So remember with diffusion, just like with pressures, and this is going to come into a lot of play when we take the respiratory section. So things are going from high pressure to low pressure. So just like it's going from high concentration to low concentration, things are going to go from higher pressure situations to low pressure situations. It's just kind of natural. If you're in a high stress, high pressure situation, well, your goal is to get to the lower pressure situation. Same thing with molecules. So there is a difference in pressure from one end of the vessel to the other. And there is the largest difference is going to be based in the aorta. High pressure is going to be here. And then looking at the beginnings of the capillary beds just past the arterioles. So more factors, again, changing the diameter. So I've mentioned this again, changing the diameter. Vasoconstricting or vasodilating. This is just natural. So this is just size. The aorta is significantly larger than capillaries. You also have more kind of branching. There's more roads that you have to travel. So decreasing the diameter increases the resistance and you have decreased flow. which is our goal in the capillaries anyways, is to slow down blood anyways, so you have time for exchange. The opposite, going from capillaries to the largest veins, the vena cavas, is going to be increased diameter, decreased resistance, increased flow. So this is just looking at it total. So kind of overall, this is vessel diameter and looking at the arteries and then down to the capillaries to the veins. So the aorta is going to be the largest artery. So largest vessel diameter. Over here is going to be kind of flow, so large flow rate. You go all the way down, so the smallest diameter are the capillaries, and then you go back to even larger are going to be your vena cava. So you have the highest pressure in the aorta. It's coming right off the heart, specifically the left ventricle. The left ventricle produces the pressure, so the highest is going to be the aorta. As you're branching and as you're going along, then it decreases. So normally at the outer capillaries, pressure is around 35 millimeters per mercury. Then you can see how much it drops even more, 18 on the venule side. So the arterial side, we have 35, and then it drops down to 18 when we're on the other side of the capillaries. So this is looking at blood pressure in millimeters per mercury average. And again, this is the size of the vessels, or actually pressure over here. So these are the actual vessels because these are the largest. But you can look at it off the heart, you're going to have highest pressure. Capillaries, it goes even lower. But actually, the vena cava have the lowest blood pressure. Why? So you still are decreasing, but now you're increasing in size. So this is going to be this big, and this is going to be this big. So even though you decrease pressure in the capillaries for exchange, as you're getting to larger and larger blood vessels, again, you're decreasing resistance. Because look how wide it is. You're increasing the diameter, so there's less effect on flow. So your blood pressure has to do with kind of pushing against the walls of the blood vessel. So aorta is going to have the highest pressure. It's right off the heart. So pressure gets lower as you're going to the capillaries. Again, it's important for exchange. And then you don't have, look how far away from the heart as you are. So from the aorta to the larger veins to the vena cava, you're going to have a lot less pressure. They're large diameter, there's less resistance, and it's a lot farther from the initial beat of the heart. So this is why you depend on valves inside the veins and muscular contraction to move the blood through your veins. So again, blood flow is going to be highest in the aorta, highest blood pressure, largest diameter. So you're going to have a large amount of flow. So coming right off of the heart, there's a high pressure, it's a high explosion of blood, and it's a very large vessel. So what happens with speed or blood flow is that kind of what we looked about. So aorta, it starts fast, it goes down to the capillaries, and then it increases again. So again, the slowest blood flow is going to be in the capillaries. Again, smallest diameter. Increase resistance, you decrease blood flow. Again, that's important. We want this because you want exchange to happen at the capillaries. Exchange doesn't happen anywhere else. Once you get back towards the venous system, you're having larger diameter, so you're going to have decreased resistance, which is increasing blood flow. So again, this is looking at speed of blood flow. It's going to be fastest as the aorta coming right off the heart, right off the left ventricle, blood's flying out. Large amount of force. If you're pushed out a lot harder, then you're going to move a lot farther versus if you're not. Decreases all the way down, slowest at the capillaries, smallest diameter, increased resistance, and then you're becoming larger and larger. Now, it's never going to get to the aorta level at the vena cava, at least blood flow, but it does increase as it's going towards the heart because it's getting larger diameter, then larger diameter, decreased resistance, increased blood flow. So again, arterial pressure is going to be the highest during ventricular systole, meaning when the ventricles are contracting, especially the left ventricle. Peak pressure is usually around during systole and what we call systolic pressure. So when you're looking at blood pressure, systolic pressure is going to be your top number. So systolic pressure is going to be your peak pressure at when your heart is contracting or your left ventricle is contracting and pushing blood. So oftentimes that's the 120. Then it decreases. It never goes to zero. There's still pressure within the arterial system or the blood vessels. But during ventricular diastole, when it relaxes, then that's the minimum pressure that's maintained. So that is called the diastolic pressure. There's still pressure within the vasculature when the heart's relaxed, but that's your 80. So 120 is when the heart's contracting, 80 is when it's relaxing. So you do want to change and want to change pretty significantly between the heart contracting and the heart relaxing.